I got rapidly discharged from the cardiologist because they're like, there's nothing else we can do for you, lose weight. And I was like, we're done
Yeah.
here.
Yeah.
And my primary care, like, I cannot imagine Dr. Hancock saying that to me. Basically, what we've done for the last 4 years is I come in with all the inflammation research and stuff, and he's on the post-viral reserve research stuff. And then we talk, and I'll say, okay, patients tried this nicotine patch, or patients are trying Ozempic, or patients are trying low dose naltrexone. Here's what the patient community is saying. Here's what research says about the inflammation and these things. You take all your medical brilliance and tell me if you think that's applicable to me. Like, we talked hyperbaric chamber at one point, and he was like, I don't think that's worth it. Like, not for you and your symptoms and your presentation, maybe somebody else, right? So we just go back and forth with ideas, and then it's, are you willing to prescribe to let me try that? Or, Amy, are you willing to take this and try my suggestion?
I think this is a great example of a doctor that embraces shared expertise, right? That
Yes.
whole creating the third space that you hear Quintner and
It's
Cohen and
exactly what it
those
is.
folks, where they're willing to shelf their ego,
Yep.
contribute their expertise when it's helpful to the context in front of them, but not, again, force feed it to somebody, and really let a patient have, heaven forbid, say in what goes on with their body and what they do. I think that's a great experience and primary care, right? It's
And
sometimes I think,
right, this is my primary care doctor. I would also like to add that this is not me going in saying you're going to prescribe LDN at 2.5 for 2 months, and then you're going to up it to 4.5, and we're going to, like, that's not what's happening. That's, hey, I read this thing on LDN. Hey, it crosses the blood-brain barrier. I don't really understand what that means. Hey, people are saying that this is helping with autoimmune diseases, which is mostly inflammatory, to my understanding. One, does that sound right to you? And he's, yes. Great. Do you think that this is a worthy trial? Right? And then he tells me what the risks are. He tells me what he thinks may or may not happen. And then we usually agree to try things for 3 months. And then I check in via virtual chart every month and tell him